Okay, so finally today we will talk about teeth. A tooth decay, and and the treatments that follow. Because I've been told that there are questions about that which need clear explanations for people to understand. Now, a tooth is a bit more complex than what we see in the mouth. Just the top. It is not just the top. It has got a crown and a root, and the root is inside the jawbone, and they are not just solidly connected to each other. There is a gap between the jawbone and the tooth. The main constituent, the main part, bulk of the tooth is formed of live hard tissue, which is dentine, which is covered on the root by a thin layer of slightly harder tissue, which is called cementum, and on the top there is a tissue which is just a cover. It is actually a dead tissue, and it is formed only once in the intrauterine phase, and that is enamel. That is the strongest organic material, the hardest organic material, and it just in the human body, and it covers the dentine. It protects the dentine not only mechanically, just by being so strong and hard. It does cover it mechanically, but that is not its only job. It actually protects it from irritation, because being a live tissue, it is prone to getting irritated and disturbed and even killed by acidity, alkalinity, heat, extreme cold. So all those things are protected by the insulating layer, that is the enamel. In the center, there is very soft, primitive tissue called the pulp, which has got its blood supply and nerve supply coming from inside the body through the jawbone. So that's a tooth. Now, what is a decay? Decay is decalcification. As you can understand, as you know, that all our hard tissues in the body are produced by salts of calcium. There are bacteria. So there are a few factors. There is bacteria, which is always there in the mouth. This bacteria can act on carbohydrates, carbs, and when it works on carbs for a significant period of time, it produces acid, which cause decalcification. So this is a complex process of bacteria working on carbs, which is in the small crypts and dents in the dental hard tissue, and with a factor of time, the acid produced can cause decalcification, which result in decay. So there are a few points that should be mentioned here. Like the kids are told not to have too much chocolate. That's because chocolate is a synthetic carb. It's like a very modified, sophisticated carb which can be very easily broken down by bacteria. But will it definitely cause decalcification? No. If the mouth is cleaned immediately after having the chocolate, because we are not giving it enough time. So it has to be a combination of these three. That is why a child who keeps, say for example, even a sweetened milk bottle or a juice bottle in the mouth for a prolonged period of time gets rampant decay all around the mouth, whereas somebody who takes enough candy but after that cleans the mouth do not get such decay. All these three have to be there together: bacteria, carbohydrates, and time. If the mouth is very clean, then the bacterial load is less. If one is not taking a lot of sweets, then this carbohydrate availability is less. And if after all these, somebody is keeping the mouth clean immediately after having anything sweet, then the time goes. So if these three factors are not available abundantly, then you don't get decay. So know that It is not that sweet is a poison, it is just that it has to be all these three. Sweet in a clean mouth for a short period of time will not cause decay. Now there is decalcification. So initially the decalcification attacks the most calcified area, which is enamel. If we can get hold of the situation at this stage, then it is very simple. This thing is replaced by, nowadays, by composite, some material. It used to be amalgam for a long period of time. Now composite is used, which is another material that is white in color, and it is filled. This is a simple filling. There may be deeper fillings, and the fillings are of different types. There are other fillings, other type of fillings which are made outside the body, which are called inlay and onlay as well, but the purpose is more or less always the same. Now you see here we have entered the live tissue, which is dentine, and that gives rise to sensitivity and pain, because dentine is composed of multiple tubules, which are called dentinal tubules, into which the pulp gives in thin branches which actually have got nerve with them. So they can be disturbed when there is a problem, there is a change in the environment of the dentine. As long as enamel is there, they are protected. When the enamel is lost, the dentine is exposed, and exposed dentine is prone to feeling heat, cold, acidity, alkalinity, even pressure. That's because through the dentinal tubules, the nerves of the pulp get stimulated. So when it goes even deeper, see, it has come very close to the pulp. This now has come into a region where the fine tubules coming out from dentinal, the processes which are coming out from the pulp, they are getting direct stimulation from the decay. So this is not a filling, this is a decay, and these are getting directly stimulated. This is called a near exposure, and in even worse circumstances, there is exposure. So there is a direct connection of the exterior to the pulp. This kind of a situation is extremely painful, and it will almost immediately kill the pulp, and the infection will spread in this soft tissue area, and this whole thing will get converted into a putrefying material and will produce pus, and that pus can travel out into the bone and can give rise to a widespread infection of the mouth, face, jaw and neck area. So in case of near exposure or true exposure, what is done? This is a process called root canal treatment. Root canal treatment is widening the gap so that there is no overhanging material, and cleaning up all the putrefied material inside the pulp chamber. And not only that, it actually widens the area, widens the canals a bit, so that it's all very, very clean, because see, we are fighting against a microscopic enemy through a macroscopic mechanism. So you have to be very sure that everything is clean. So that is the actual process of preparation, biomechanical preparation in a root canal treatment. So everything, the pulp and the neighboring dentine has been cleaned up, making a big hole, hole over there so that there is a direct entry. And now what? Now this pulp chamber is filled with an inert material called kataparka. The root canal cleaning is done either by hand or by a machine that is used nowadays, where there are files somewhat like that's the top, and then there is a spear which has got some barbing that will, once it goes in, it will go in easily, but when it comes out, it will take out pulp and also shavings from the walls of dentine, and that will clean the inside. So this can be loaded onto a machine or can be done by hand as it used to be for a long time. So that has cleaned the inside, and the whole inside has been filled now with an inert material called gutta perca, so that there is no connection with the rest of the body. The bacteria cannot go back in, and obviously the inside is clean from bacteria. At this stage, the top is also filled up with a significant amount of filling material. Now that's the end of root canal treatment, and we hope that this tooth will remain in the body without causing any pain or any infection, by being kind of an inert object that is serving its purpose of mastication and the rest. However, if we leave it like this is going to be a brittle tooth, because the dentine maintains its integrity and remains good as long as the pulp is inside, because the pulp, being the vital tissue, continuously provide to the calcium salt deposit and such stuff, so that the dentine remains strong for forever as long as the pulp is there. Now once the pulp is gone, the dentine has got no new supply of nutrient to remain strong. So eventually it becomes weak and the tooth becomes brittle. That is why once a root canal treatment is done, we need to perform a procedure called crown preparation. What is crown preparation? We will just replace this top with something strong, a cap that will cover the whole area that used to be the normal crown, and it will serve the purposes of the normal crown. So to do that, we have to reduce the tooth a little, otherwise the total crown will be bigger than the size of the tooth itself, and that is not allowed by the body, by the nerves and muscles that surround the area. So you see, now the tooth has been reduced, and on the reduced tooth an impression is registered. Nowadays sometimes the impression is registered in the CAD/CAM system by a scanner, and this cap is prepared thereof, and the cap is cemented to the prepared tooth, and you get the whole structural function of the tooth back. That is generally what happens. We talk about tooth, its structure. We need to know about its structure before we know about what is decay. We discussed about decay, and we told about what happens as the extreme result of decay, and if we can get hold of the tooth before all is not lost. What I mean is, before the infection and things have not become so bad that the bone is lost and there's a pool of pus around, then we can save the tooth by doing a root canal treatment, by filling in the canals with an inert material and fabricating a nice crown on top. And you see, we have got back the same thing as what we started.